Okay, good afternoon, everyone, and welcome to another social emotional workshop. I'm Toni Cureton, your host, and today we are with Live Right Structural Recovery Corporation, and we are going to be talking about ADD and ADHD and all of the things that goes along with identifying this disorder and dealing with disorder and functioning as a productive person with this disorder. So, ladies, welcome back. We're so glad to have you, and you can go ahead and get started.
Hi, I want to introduce ourselves. I am Brandy, and I have Kelsey here with me today, and she is going to be reading off the ADD and ADHD, and then also with the PTSD.
All right, so attention deficit hyperactivity disorder, that's ADHD. So ADHD is a mental health disorder that includes a combination of persistent problems, such as difficulty paying attention, hyperactivity, and impulsive behavior. It's marked by an ongoing pattern of inattention and/or hyperactivity, impulsivity that interferes with functioning or development. And so people with ADHD experience an ongoing pattern of the following types of symptoms. Inattention, which is where a person may have difficulty staying on task, sustaining focus, staying organized, and these problems are not due to defiance or lack of comprehension. So hyperactivity, this is where a person may seem to move about constantly, including in situations when it's not really appropriate, or they're being excessively fidgety, tapping a lot, talks a lot, etc. In adults, hyperactivity may mean extreme restlessness or talking too much. And impulsivity is when a person may act without thinking or have difficulty with self-control. Impulsivity could also include a desire for immediate rewards or the inability to delay gratification. An impulsive person may interrupt others or make important decisions without really considering the long-term consequences. ADHD symptoms in children, these are like the inability to sit still, inability to wait their turn, inability to play or work quietly. Some people tend to be disruptive and not listen in class, constantly running and climbing, talking a lot again. And then in adults, it can be being fidgety, not being able to sit still for a long period, being impatient. They might have a low tolerance for frustration, recklessness, careless mistakes, excessive talking, and interrupting others are all signs and symptoms of ADHD. And then in comparing the two again, most children with ADHD are first diagnosed when behavior or performance in school begins to become a problem. Although boys are 3 times more likely to have ADHD, girls can have it too. Children with ADHD might suffer from poor performance in school and difficulty maintaining friendships. And if it's left untreated, ADHD can increase your child's risk of developing learning difficulties, anxiety, and depression. In adults, up to 60% of people with ADHD, as children, still have it as adults. The signs of ADHD do change as you get older. And as an adult, ADHD can make it difficult or impossible to focus at work. It's common to experience memory problems and difficulty focusing, and some people do struggle with maintaining personal relationships due to ADHD. Different types of ADHD are hyperactive impulsive ADHD. This is a type of ADHD where the person fidgets and talks a lot. It's hard for the person to sit still for a long time. The individual might feel restless and have trouble and have trouble with impulsivity. Someone with this type of ADHD may interrupt others a lot, grab things from people, or speak at inappropriate times. So it's hard for the person to wait their turn. or listen to directions, and a person with impulsiveness may have more accidents and injuries than others. Inattentive ADHD, a type of ADHD where it's hard for the individual to organize or finish a task, to pay attention to details, or to follow instructions or conversations, and the person is easily distracted or forgets details of daily routines. And then combination ADHD is a type of ADHD that occurs when an individual has both inattentive and hyperactive impulsive symptoms. So some treatments for ADHD are as follows. There's behavior therapy. This is a treatment option that can help reduce these behaviors. It's often helpful to start behavior therapy as soon as a diagnosis is made. When it comes to medication, medication can help children manage their ADHD symptoms in their everyday life and can help them control the behaviors that have caused difficulties with family, friends, and at school. So medication can affect children differently and have different side effects, such as decreased appetite or sleep problems. One child might respond well to one medication and not to another. So it's not one medication across the board. And psychotherapy. This is counseling for adult ADHD and generally includes psychotherapy, education about the disorder, and learning skills to help you be successful. When it comes to PTSD, this is post-traumatic stress disorder. Post-traumatic stress disorder is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, series of events, or set of circumstances. An individual may perceive this as being emotionally or physically harmful or life-threatening, and it might affect their mental, physical, social, and or spiritual well-being. People with PTSD tend to have intense, disturbing thoughts and feelings related to their experience that last long after the traumatic event has ended. They might relive the event through flashbacks or nightmares. They may feel sadness, fear, anger, and they might feel detached or estranged from other people. People with PTSD may avoid situations or people that remind them of the traumatic event, and they might have strong negative reactions to something as ordinary as a loud noise or an accidental touch. Examples include natural disasters, serious accidents, terrorist acts, war, combat, rape, sexual assault, historical trauma, intimate partner violence, and even bullying. And so why PTSD tends to develop? It's a survival mechanism. So one suggestion is that the symptoms of PTSD are the result of an instinctive mechanism intended to help you survive further traumatic experiences. So, for example, the flashbacks many people with PTSD experience may force you to think about the event in detail, so you're better prepared if it happens again. The feeling of being on edge, which is hyperarousal, might develop to help you react quickly in another crisis. But while these responses may be intended to help you survive, they're actually very unhelpful in reality because you cannot process and move on from the traumatic experience. Another reason that PTSD develops is because of high adrenaline levels. Studies have shown that people with PTSD have abnormal levels of stress hormones. So normally when in danger, the body produces stress hormones like adrenaline to trigger a reaction in the body. This reaction, often known as the fight or flight reaction, helps to deaden the senses and dull pain. People with PTSD have been found to continue to produce high amounts of adrenaline even when there's no danger. And it's thought that this may be responsible for the numbed emotions and hyperarousal experienced by people with PTSD. Some other reasons that PTSD tends to develop is due to changes in the brain. So in people with PTSD, parts of the brain that are involved in emotional processing appear different in size in brain scans. And in people with PTSD, the hippocampus, the part of the brain responsible for memory and emotions, appears smaller in size. It's thought that changes in this part of the brain might be related to fear and anxiety, memory problems, and flashbacks. So the malfunctioning hippocampus may prevent flashbacks and nightmares from being properly processed, so the anxiety they generate does not reduce over time. And treatment of PTSD results in proper processing of the memories so that over time, the flashbacks and nightmares gradually disappear. Some stats about PTSD are about 5% of adults in the US have PTSD in any given year. Women are more likely to develop PTSD than men. This is due to the types of traumatic events that women are more likely to experience, such as sexual assault, compared to men. About 8% of women and 4% of men will have PTSD at some point in their life. Veterans are more likely to have PTSD than civilians. Most people who go through a traumatic event will not develop PTSD. About 6% of the US population will have PTSD at some point in their lives. And this counts people who have PTSD at any point in their life, even if their symptoms do go away. And many people who have PTSD will recover and no longer need diagnostic criteria for PTSD after treatment. A couple symptoms of PTSD are so post-traumatic stress disorder symptoms may start within 1 month of a traumatic event, but sometimes symptoms don't appear until years after the event. And these symptoms can cause significant problems in your ability to function. And PTSD symptoms are generally grouped into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reaction. Intrusive memories are a symptom of PTSD, and symptoms of intrusive memories may include recurrent, unwanted, distressing memories of the traumatic event, reliving the traumatic event as if it were happening again, which is what we call flashbacks, upsetting dreams or nightmares about the traumatic event, and severe emotional distress or physical reactions to something that reminds you of the event. Avoidance is a symptom, and symptoms of avoidance can look like trying to avoid thinking or talking about the traumatic event, avoiding places, activities, or people that remind you of the traumatic event. Negative changes in thinking and mood. Symptoms of this can include negative thoughts about yourself, other people, or the world, hopelessness about the future, memory problems, including not remembering important aspects of the traumatic event, difficulty maintaining close relationships, feeling detached from people, lack of interest in activities you enjoyed, difficulty experiencing positive emotions, and then feeling emotionally numb. Changes in physical and emotional reactions are symptoms of PTSD. And then symptoms of these changes can include being easily startled or frightened, always being on guard for danger, self-destructive behavior such as drinking too much or driving too fast, trouble sleeping, trouble concentrating. One might be more irritable, have more angry outbursts or aggressive behavior, and overwhelming guilt or shame. And PTSD affects the body in a number of ways. People with PTSD may experience physical symptoms such as increased blood pressure and heart rate, fatigue, muscle tension, nausea, joint pain, headaches, back pain. The person in pain might not realize the connection between their pain and a traumatic event. So for people with chronic pain, the pain may actually serve as a reminder of the traumatic event, which does intensify their symptoms. Some people who develop PTSD and chronic pain also experience depression and alcohol, and prescription medication misuse. So how we can treat PTSD is, there's a couple ways. One is psychotherapy. So several types of psychotherapy, also called talk therapy, may be used to treat children and adults with PTSD. A couple different types of therapy are cognitive therapy. This type of talk therapy helps you recognize the ways of thinking, cognitive patterns that are keeping you stuck. For PTSD, cognitive therapy often is used along with exposure therapy. In exposure therapy, this therapy helps you safely face both situations and memories that you find frightening so that you can learn to cope with them. Exposure therapy can be helpful for flashbacks and nightmares. In EMDR, this is eye movement desensitization and reprocessing. EMDR combines exposure therapy with guided eye movements that help you process traumatic memories and change how you react to them. Now, when it comes to medication, there are several types of medication that can help improve symptoms of PTSD. A couple of these are antidepressants, which these drugs can help symptoms of depression and anxiety. They improve sleep problems and concentration. And anti-anxiety medications can relieve severe anxiety and other related problems. So therapists who treat people with PTSD will often combine these treatments in order to get the best results. In conclusion, ADHD. A person with ADHD has differences in brain development and the brain activity that affects attention, the ability to sit still, and self-control is altered. Symptoms are in adults and children. ADHD affect children and adults differently. There are various types of ADHD, and there are various types of ways to treat ADHD. In PTSD, this is a disorder that occurs in people who've experienced or witnessed traumatic events. PTSD develops as a result of an instinctive mechanism intended to help you survive further traumatic experiences. Parts of the brain that are involved in emotional processing are affected by PTSD. There are many symptoms that point to someone having PTSD, and there are many different ways to treat PTSD. Do you guys have any questions?
You guys, if you have questions, you can unmute, or if you prefer, you can type it in the chat and I'll be more than happy to read it. All right, then we will wrap this session up. Thank you so much, ladies. Excellent presentation, as always. And thank you guys for joining, and everybody have a great day.
Thank you
guys so much. Have a great day.
All righty. Bye.
Good one. Bye-bye.